Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, yes, you can definitely WhatsApp me on 922681060. My dear friend, this is the series going on. Everybody now knows that because they have seen nearly 20 plus videos in the same series. Dr. Deshpande is discussing the different patients coming with the different complaints and how the general practitioner, the doctor, the patient should think about that particular case. Today, I have the patient of 1.5-year-old male child. 1.5, very small baby of old male child. So the mother is coming with, of course, the father is also there. Both are coming and they say that, see doctor, my child is passing watery motion since morning and has vomited 3 times. And doctor, he is crying, irritating almost continuously. We are afraid, doctor, what is there? How we can stop that loose motions? Okay, just relax. I'm there. I will take care of. Nothing to be worried about. Huh? So we have to give first assurance. So I have in front of me that 1.5-year-old male child with watery loose motions. Okay, and also vomiting. So loose motion plus vomiting. So there is definitely some inflammation and infection in the stomach as well as the intestine. So whenever there is a both side inflammation and infection, that disease is called as a gastroenteritis. Gastro means stomach, enteritis means colon, small intestine and large intestine. So gastroenteritis, whenever there is a ITIS, that is the inflammation. So this is the inflammation of stomach and intestine, gastroenteritis to 1.5-year-old child. Oh, now see very carefully. Whenever there is a gastro or gastroenteritis, another simple word is a gastro. Because gastro to the children and gastro in the old people more than 70, always be careful. Be cautious. Oh, children and old people, loose motion, dangerous. Loose motion with vomiting, more dangerous. Doctor, why? Yes, I am going to tell you. Just wait. So the doctor has to look first at the baby and see that whether the child or that baby is dehydrated. The doctor should see the eyeballs. It will be the sunken. Sunken eyeballs indicate dehydration. Water has been lost from the body. And also you should see whether there is a fever, red face, and child is crying, irritating. So is this baby is a toxic? Because the doctor has to take care of first immediate cautious thing is a dehydration, and this particular dehydrated child will need urgent and rapid fluid replacement. Urgent and rapid fluid replacement, that is IV fluids, intravenous fluids will be necessary. But before sending to the hospital, let me check further. Actually, then I asked the father and mother whether this child has passed a urine, and do you feel that that urine quantity is a less, that means is a scanty or not sufficient quantity? Actually, the doctor, you see, we have not noticed very carefully, but the child is passing, but it's a small amount. Yes, you are right, doctor. It's a small amount that he has not passed much urine from the morning. Oh, so this is oliguria. Less urine is going out. That means the dehydration is more. Grade 2 dehydration. First is a sunken eyeball. Baby is a toxic. Then the urine is passing less. That is grade 2 dehydration. Okay. Then the doctor should palpate the anterior fontanelle. Palpate the anterior fontanelle whether it is open, because if it is a fontanelle are depressed, that also indicates the dehydration is more than grade 1. Depressed fontanelle dehydration more than grade 1. Okay. Then examine the eyeballs. Doctor should examine the child's eyeball. Are they sunken? Then when he's crying, also try to check the tongue, whether that tongue is also dry. So when the eyeballs are sunken, when the tongue is dry, then that is grade 2 dehydration. Eyeballs sunken, tongue is dry, grade 2 dehydration. Okay, what doctor next should do? Pinch the child, take the pinch the skin over the forehand or the abdomen. Best is the abdomen. Pinch the skin, I am telling you like here, over the abdomen. Suppose this is the abdomen, and pinch it, release it. Pinch it and release it. If this fold flattens very slowly, that means wrinkle is maintained there. This indicates loss of elasticity. If after pinching that particular fold remains, that wrinkle remains, this is loss of elasticity, grade 2 dehydration. Grade 2 dehydration. Okay. Next, inspect the perianal area, because loose motions are there. Anal opening, see the anal opening, perianal area, for the redness and the skin excoriation. Redness and skin excoriation, perianal, around the anal opening. Instruct the mother, you have to advise the mother to dry always perianal area after each motion and apply Siloderm paste. You can prescribe Siloderm paste. Clean, dry and apply Siloderm paste so that it will prevent any inflammatory changes around the perianal region with the skin. Then also doctor should check the pulse of the baby. Pulse of the baby. If the pulse is feeble but fast, that is grade 3 dehydration, that is severe dehydration. So what are the other signs of severe dehydration? Another sign. This is one sign. Fast, feeble and fast pulse. But deep sighing respiration, semi-consciousness and anuria are the signs of severe dehydration. So I think you have understood the importance of gastro, loose motion, vomiting. Concentrate on dehydration. So what are the important words in this particular case? Number 1, degree of dehydration, skin turgor, dry tongue, sunken fontanelle, sunken eyeballs, scanty urine, and weak and fast pulse, feeble pulse. Okay. So what should be the immediate quick actions? Number 1, oral rehydration, orolite, anti-diarrheal medicines, anti-spasmodic medicines, anti-emetic medicines, and antibiotics can be given. I repeat, anti-diarrhea to control the loose motion, anti-spasmodic to control the pain in the abdomen, anti-emetic and antibiotic. Clean the nipples. The doctor should ask to the mother, request to the mother that whenever you are feeding to your child, first please clean the nipples before feeding. Boil the milk before or a cup before. That means if the child is having the the external feeding, then that particular bottle, cup, vessel should be very, very carefully sterile. Okay. Then whenever there is a dehydration of 2nd or 3rd degree, immediately admit the child into the hospital, because intravenous fluids are necessary in the grade 2 dehydration. First, the doctor in the hospital will give Ringer lactate solution. Ringer lactate solution to control the dehydration. Then isolite P as per the formula that can be given for the case of dehydration. So my dear friends, today Dr. Deshpande tried to talk or discuss with you regarding this simple case of gastroenteritis. I wish that you should like this video, share this video, and don't forget to subscribe my YouTube channel, press the bell button icon to get the notification of such further 10, 12, 15 videos. Okay. I wish all the best. Take care and see you soon. Thank you.